Hi, I am Jami Ober, LMFT. I am one of the therapist team leads for Cummins Behavioral Health System's school-based program. And today I'll be talking about youth and young adult mental health, prevention, and early intervention. For our introduction here, in 2023, 40% of U.S. high school students reported persistent feelings of sadness or hopelessness, and nearly 1 in 5 seriously considered suicide. And this underscores a national mental health crisis among our youth. For today, for our presentation, our goal is to explain the mental health challenges in youth and young adults and understand that they're prevalent and significant, but that early intervention and prevention strategies can lead to better outcomes. Mental health is something that's important at every life stage, and we've broken that down here below. So in early and middle childhood, we're looking at birth to 11 years old. We're looking at reaching developmental and emotional milestones and learning healthy social skills and how to cope with difficult emotions and when there are problems. And children who experience good mental health have a positive quality of life and just function better in their different environments, whether that's home, school, social settings, and in their communities. For adolescents, we're looking at 12 to 17 years old. And this is a unique time. As we all know, we're developing who we are as people. And we're looking at different behaviors and habits that we're establishing during this time that will carry over into adulthood. And this is also an important time of developmental changes, similarly to early and middle childhood. And lastly, here for young adulthood, we're looking at 18 to 26 years old. This time can come with major transitions, such as entering college or the workforce, for some living more independently through securing independent housing or starting your own family. And positive mental health and well-being in young adulthood can help with those transitions. And those behaviors and habits will also carry over into the rest of the adult years. Some statistics regarding mental health needs in youth and young adults. Over 5.3 million adolescents had a current diagnosed mental or behavioral health condition during the time of this study. Between 2016 and 2023, the prevalence of diagnosed mental or behavioral health conditions among adolescents increased from 15 to 20%. And a 2024 study found that 36% of young adults aged 18 to 25 reported experiencing anxiety and 29% reported experiencing depression. And we do have a couple of other videos in this series referencing both anxiety and depression and some tools to managing those and understanding them better. So now we'll go over what factors impact mental health. So risk factors increase the possibility of experiencing poor mental health, while protective factors increase the possibility of experiencing positive mental health. And we do have a couple of other videos in the series as well referencing these, but for today's presentation, we'll just go over them briefly. So for our risk factors, we're looking at social drivers. Now, social drivers can be things such as interpersonal and institutional discrimination, lack of access to housing, healthcare, education, or to employment and economic opportunities, adverse childhood experiences, otherwise known as ACEs, interpersonal violence, social isolation, poor emotional well-being or coping skills, and ongoing or chronic medical conditions. And those can be things such as a traumatic brain injury or TBI, cancer, or diabetes, just to name a few. And then for protective factors, again, the things that will help with experiencing positive mental health, access to quality employment, housing, and education, strong social connection, and stable positive relationships, positive coping skills, and really just a general sense of safety. So living in safe communities that have access to that preventative care, as well as mental and physical health services. We are all pretty aware of the impact of social media and technology, but just to name a few points on the impact on mental health, frequent social media use might be associated with distinct changes in the developing brain in the amygdala, which is used for emotional learning and behavior, as well as the prefrontal cortex, which is important for impulse control, emotional regulation, and moderating social behavior, and could also increase sensitivity to social rewards and punishments. This could also be known as peer pressure and someone's response to those. Social media can provide a positive community and a connection with others who share identities, abilities, and interests to help prevent against isolation. And it can also provide access to important information and create a space for safe self-expression. But it can also lead to depression and anxiety. It can expose youth to explicit content, and it can also heighten incidents of bullying, or otherwise known as cyberbullying. And caregivers can do several things to prevent some of the impact here, creating a family media plan. So this could look at how the family unit uses social media and technology, discuss safety plans, maybe discuss timeframes where we're allowed to use social media, to teach and empower how to use technology appropriately. reporting cyberbullying and exploitation, whether to local law enforcement or schools, just to ensure that there's outside help and taking that seriously, and encouraging children to foster in-person friendships as well as those in social media. And again, referencing here, what can parents and caregivers do? We actually have another video series referencing this, as well as what teachers can do to support. In general, looking at prevention, why this matters is that early intervention helps reduce the severity of mental health issues, which helps improve long-term outcomes. Mental Health America is the nation's leading national nonprofit, which is dedicated to the promotion of mental health, well-being, and prevention. And they've identified 4 different categories for prevention and exploring the different ways we can support those reaching their recovery goals. And this is also broken down into some of those categories we mentioned earlier with the different life stages. So just working our way from left to right here through these categories. For prenatal and early childhood, for health, we're looking at some of that prenatal care. So whether that's substance use needs that occur while a child is in the womb, maternal health in general, or toxic exposure due to the environment. For safety and security, we're looking at exposure to intimate partner violence, either while a child is still in the womb or while they are young. Resources, so healthcare, housing, access to food, all of these requirements to be healthy and thriving at a young age and really at all life stages. And then with relationships, really the main relationship at this point is going to be the parenting relationship. So making sure that that's a healthy one. For early childhood and puberty, we're looking at nutrition, which is of course important at all life stages, but especially during this time frame where we're really looking at meeting some specific developmental goals. For safety and security, we're looking at adverse childhood experiences or ACEs, some specific traumas that might occur around this time, and exposure to community violence. Resources-wise, homelessness is something that, especially during this childhood, and again, of course, during all life stages, but especially during this time when we're trying to meet those developmental goals, something that can really get in the way. And then with relationships, again, looking at the parenting, the family relationship as the primary one at this time. For puberty and early adulthood, for health, we're looking at sleep, substance use, and physical activity as something to keep in mind and be monitoring for. For safety and security, all of the things listed in the above columns, but also as these folks move into their own intimate relationships, looking at the potential impact of intimate partner violence. For resources, helping this age group identify their support system. So whether that's in the home or outside of the home, understanding where they can go for help, what resources are available to them. And then in relationships, looking for things like bullying or isolation. So bullying, as we mentioned in the previous slide, potentially cyberbullying, but also in the school setting. And then for isolation, which is often a beginning sign of depression or social anxiety. If we see folks in this time frame doing that when it's one of the most social times for them, could be a warning sign. We do have another video or several other videos that are relevant to this slide. So the trauma-informed care and healing video that we have, we've referenced multiple traumas in this table. And so learning more about that can be helpful in identifying what are some of those key factors that can impact someone's mental health. We also have a couple of videos on substance use specifically, so the link between mental health and substance use, as well as addiction recovery in general, which is in our bottom left box there when we're looking at those in puberty and early adulthood. Some of the important early intervention steps we can take. So again, breaking this into the different life stages. For prenatal and early childhood, new families can engage in the programs that are available for early childhood specifically. And these programs provide education about child development, positive parent-child interactions. And these groups can serve as a social support for parents and families. It can also increase access to social and health services. So some of these organizations are Healthy Families, Nurse Family Partnership, and Incredible Years. These are national organizations that provide these resources. And I think it's important to note that although this slide does reference parent interactions, really this is a support for caregivers in general. For early childhood and puberty, we're looking at the schools to provide a lot of the supports that we're going to be using during this time. So in addition to watching for the early signs and identifying any potential needs, just providing students with the tools they need to develop some of those social skills and just how to be mentally well. This is also the time that they might be starting to develop IEPs or different plans to support the child in their ongoing school years. And then lastly here, for puberty and early adulthood, we're looking at some of the unique challenges of high school and the transition to adulthood that we referenced earlier, really moving more towards the independence. We're going to be screening for more mental health problems here. And this is going to be something that we need to keep an eye on for positive screens. That should be followed by a comprehensive mental health assessment. Those screens are really looking for just some overall symptoms, where the mental health assessment is going to be doing a deeper dive into the needs that exist. Life skills training and wraparound services are available during this time frame. These are some of the services that my team provides in the school setting, but are available in both schools and outpatient settings. And then for those who don't have access to specialty care or maybe some of those community resources, focusing on reducing stress, increasing sleep, and proper nutrition are important during this time, and all of the other life stages as well. These are things that can be done in the home, even if there are not connections to outside supports. And again, the videos on what can parents or caregivers do, what can teachers do are available in our video series as well. Some additional interventions. So in general, for building mental health resilience, we're looking at promoting some of those positive coping strategies to help with difficult emotions or stress. Some of those on here are listed. So mindfulness, journaling, regular physical activity. Again, these are all things that can be stressed in a household without access to outside resources. If you're unsure what mindfulness looks like, there are plenty of resources online on YouTube. There are guided imagery and meditation videos. We have apps such as Calm and Finch, which are really popular, and many other mood tracking apps. And then also we want to just encourage open communication about emotions in the home and at school, just to know that there is that safe space to communicate. Going into that, we're looking at creating supportive environments. So for schools, we should be implementing mental health education, peer support groups, access to counseling, and then also providing training for educators to recognize what mental health challenges actually look like and how to respond to them. And then we're hoping also in the schools that we are fostering that element of communication, so that students feel comfortable going to their supports at school if they do need that additional support, so they can access some of those resources the school might offer. And then for the parents and caregivers, we're really hoping that everyone is going to be monitoring for signs of distress and creating that safe space for open discussions. While, of course, some of these transitions are going to be stressful on their own, we're really looking for those youth that seem to be struggling to thrive during those times and don't seem to move through them easily, or at least get on the other side of them. Promoting awareness and reducing stigma, we're hoping to encourage mental health literacy campaigns in schools and communities. This goes back to folks just knowing what to look for, knowing where to go for the resources, knowing how to talk to people about these things. And also educating on the importance of seeking help and debunking myths around mental health. We know that stigma is still there. There are still plenty of folks that do not feel comfortable talking about it, but making sure people know that seeking help does, for most people, lead to feeling better, and being able to know what those resources are. And then accessing early intervention services. Again, as we've referenced in this slideshow, early intervention really is the key to increased success and feeling better overall. So school-based mental health programs are one way we can get started early on some of these things. As referenced above, peer support groups, counseling services, life skills groups, those types of things are becoming more and more prevalent in schools. And this is something that my team does, providing that counseling and life skills support in the school setting. And then outpatient counseling services are, of course, an option. And so if the school-based program is not an option, or if folks are homeschooled and need an outpatient office, those are available to folks as well. Some national resources here I have listed. There are, of course, many more than this, but these are just some of the big ones. The National Alliance on Mental Illness, or NAMI, is a great resource, and their website there has plenty of additional resources available. Same with Mental Health America. That was the organization I listed earlier that had those different categories of prevention, and they have resources on their website as well. SAMHSA's helpline is there, and their website has some additional resources. And then lastly, they're the Trevor Project, which is specifically for our LGBTQ plus young people. They have their website there and also have a helpline, a text line, and that kind of support. Mental health challenges in youth and young adults are widespread, but prevention and early intervention can significantly improve outcomes. Building resilience, reducing stigma, and promoting mental health education are critical. By supporting mental health early, we're not only changing lives, we're shaping a healthier, more resilient future for everyone. And finally, I have a list of sources here for some of those statistics that were referenced earlier in the presentation. Thank you so much.